Good afternoon, everybody. This is Dr. Michael Beebe with Arete Chiropractic, and this is part of our collaborative business series, and we are hosting Betsy Learner with Family Acupuncture and Wellness here in Portsmouth. Hi, Betsy.
Hi, Michael.
We are so excited that you're going to spend some time chatting with us today about a little bit about acupuncture and about acupuncture and family wellness, your business that's been serving people for many years here in the Seacoast. And we'll talk about what our business is going to be doing over these next couple months as New Hampshire slowly reopens, how we're going to keep people safe, and then what our vision is for healthcare in the Seacoast as we start to emerge from this pandemic. So Betsy, go ahead and share a little bit about yourself, how you got into acupuncture, and then what a regular visit looks like with you guys.
Okay, great. First of all, thank you for doing this. It's so great to pull together different parts of the community and create a village so that patients can really feel like they have a whole team they can draw support from.
Yeah.
So thank you.
You're welcome.
Yeah, my name's Betsy. I'm an acupuncturist and a cranial sacral therapist, and I'm a co-founder of Family Acupuncture and Wellness with my husband, Adam. I do the hands-on acupuncture and cranial sacral treatments, and we also offer through my husband's supervision, functional medicine, nutritional counseling, and health coaching. So we have those two divisions of the business. So I'll talk to you about the acupuncture side of the business. In terms of what inspired me to go into acupuncture, when I came out of college, I had a corporate marketing job, and it was rewarding sometimes, but after a while, it just got to be really stressful. And I was looking around at the other people, realizing that, like, wow, they don't make this look like it's getting better. Life looks too hard here. So I was looking for ways to make myself feel better. And I started to participate in a meditation study group. And it was really that like led me down the path here, in part because two of the people in that group were already acupuncturists. And so they started to talk to me about the way acupuncture works in the body. And also just through my own experience in that meditation group of feeling for myself, the mind-body connection and what a difference that can make in how you feel in your body. Yeah. And it was really like astounding to me that that could make such a difference. So that's really what inspired me to take the leap and leave my job and go to acupuncture school.
That's incredible. It's like a huge leap of faith, but also just exactly where you needed to be because you've helped so many people feel better over the years.
I have no regrets. It's been really rewarding.
Yeah. So when a person comes in to your office, what is a traditional visit for people who may not have tried acupuncture, might be wondering about that?
So it's a little bit different these days. We used to do in person an hour and a half for the first session. Right. Because we really want to take time to go through a thorough health history and talk through all the body systems. The tradition in Chinese acupuncture and Chinese medicine is to look at the body as a holistic unit and take these symptoms that may seem unrelated and try to come up with a pattern that would be like the primary imbalance that we would be addressing. So it's like the symptoms are these, the branches is how they describe it. And then what we try to do is figure out what the root cause is so that we can address the root cause and then address symptoms so that they get more long-lasting relief. But so these days we're doing that, the health history part over the phone or over Zoom. And so we'll go through that thorough analysis of all the body systems, digestion, sleep, all kinds of things. And then when you're here in person, feel your pulse and take a look at your tongue, look at your posture, and then put together a treatment plan. Usually, for most conditions, we would want to see you twice a week for 3 or 4 weeks as the initial series. Some people respond faster, some people respond slower, but as a general guideline, that's a typical plan. And each time you're here, you get to lie down and have the needles put in place And when the needles go in, your body responds by releasing endorphins. So it's a really feel good experience. People kind of melt into the treatment table. And when they get up at the end of a session, they feel like they've had a massage or they've had a little power nap and they get up feeling great.
Yeah. And I have not only referred patients, but I've been a patient myself and received really great benefit from the care at your office. I think that, like chiropractic, acupuncture helps the body find the root cause and really heal itself, because we're born with every innate ability to heal that we could possibly possess. And I don't think lack of health or a problem is because we didn't have enough ibuprofen in our system, right? So it's really important to start to rediscover that for everybody, that your body is perfectly designed to combat illness and achieve optimal health with everything that it's got inside of it. And sometimes it needs a little bit of help, and acupuncture can be an amazing tool for that. Chiropractic can also be helpful. In our office, with Arete Chiropractic, we study the spine, particularly from the top down. And that's because when you're looking at the spine, the upper neck, this is the most freely mobile area of the entire spine. So when traumas come in, accidents, injuries, repetitive stress, people have been at their computers or staring at devices way more than they've ever been in the past. And that repetitive stress or injury can accumulate in the spine, and oftentimes it's going to affect that upper neck. And when the upper neck is misaligned, what happens is the eyes don't sit level with the ground. And then the rest of the body will start to shift and change to make the eyes level with the ground. So the body will compensate. And that compensation pattern wreaks havoc lower down. Muscles are tighter, joint motion is abnormal, and then we're ending up with shoulder pain, hip pain, lower back pain, and a lot of other dysfunction that can affect our weight bearing joints. And so in our office, we look at the spine from the top down, and we see, when people come in, much like you, we're doing a really thorough health history, and we're seeing, do you have a problem in your upper neck, in your spine, that's contributing to your symptoms? And if you do, then we can help. And when we correct that spine really gently from the top down, we don't do any manipulative therapy, so there's no twisting or popping of the neck, but very gently adjust that spine from the top down. It helps the joints move better, which releases the interference from the nerves, and then the nerves can actually fire to the rest of the body correctly to organize the body's innate healing capability. And it's something that I'm very passionate about. And I know that we both work to find the root cause of the problem rather than just trying to cover up the symptom.
Absolutely. Yeah. I've been the recipient of your good work, and it was amazing to go through that process of starting at the upper neck and watching the whole body adapt to the point where my feet fit in my shoes differently by the end of I think it was 6 weeks later.
Yeah.
It felt great.
Yeah. And it just co-managing patients back and forth between chiropractic and acupuncture in our offices has really helped people get better faster. I think it's been a really fun journey, and I think that our offices are resources for people here in the Seacoast.
Yeah.
So COVID's on everybody's mind. You touched on the telemedicine for the initial intake. When we look at your office beginning to reopen, possibly in June, what practices are you going to be putting in place to just make sure that everybody's as safe as possible?
Yeah, well, so we're getting very thorough guidance from the National Acupuncture Association and, of course, from the CDC. And so we are installing all kinds of no-touch sanitizer dispensers and soap dispensers. Everybody's going to be wearing masks. We're going to have new HEPA air filtration and periodically open the windows to air out the space. There's a long list of steps that we're going to be taking, sanitizing all the high touch surfaces. We're going to have to reduce the number of people who come and go through the door so that we have time to really sanitize and clean really thoroughly.
Yeah, and I think that's right on par with what we've also been doing in the office. And I think that's going to help you guys be able to serve the people that need the care and also keep people as safe as possible. Like, yeah, in our office, same practices. So chiropractic was deemed an essential healthcare business and is an essential healthcare practice, much like I feel like acupuncture should have been, because it helps manage chronic illness for people and or emergency cases. So just in the past couple of months, we've been able to keep a handful of people out of emergency departments or urgent care facilities from car accidents. And that really limits exposure and infection for all, or risk of infection for all involved. So in our office, we're taking staff temperatures every day. We're, again, limiting number of people in the office. People are able to wait in their car, then be called into the office when it's exactly time and we're ready for their visit. We have private treatment rooms. They can then recover in their car as well. We are, wearing PPE. People can request that we wear gloves during the treatment if needed. We're wiping down and sanitizing all the tables and the high-touch surfaces in between each and every office visit and patient. So it's, we're doing everything we can to, again, make it as safe as possible and also be available for people who are in need of the care. And, as we look forward to the next couple of months, one of my visions for the Seacoast is that people will start to recognize, like we mentioned earlier, that it's not just about preventing infection or disease, but really about helping the body be more resilient in the face of disease as we live with COVID. So what's your vision for the Seacoast and healthcare in the future?
Well, absolutely. This whole pandemic has really demonstrated how making yourself as resilient and healthy as you can is so important. It's really the difference between life and death. And in the meantime, it's really about quality of life and living the best, fullest, happiest, most productive life that you can. My vision for how we're going to play a role in that is by really helping people heal. First of all, it's been very traumatic. Even if not physically, it's been emotionally traumatic for so many people. And that's actually an area where acupuncture can really excel. There's the physical parts of syndromes and symptoms that we treat, and then there's also the emotional aspect that comes along with it.
Yeah.
It's great at addressing that. So we want to be a resource for people who are having PTSD or having insomnia, having increased anxiety. There's going to be a big increase in that as a result of it. So that's one way. And then, like you were saying, there are people who haven't been able to have access to care. So we're going to do our best to get people back to feeling like they can function again by treating their pain and their digestive symptoms and what have you. So
yeah, I completely agree that there's a physical aspect of this pandemic and there's an emotional aspect of this pandemic, and reaching out for healthcare resources to support you in both aspects are very, very important. And we all kind of knew that taking care of our health would allow us to live longer and live better. And I feel like COVID has just really put a flashing red light around that and highlighted it. Because these comorbidities that we always knew were bad for us, diabetes, obesity, cardiovascular disease, we always knew that these were, okay, these are not good for our health. But now when you see a direct relationship where if there's a viral load on top of a comorbidity, there's X amount of chance that it's going to be much more impactful to your health or possibly even result in death, then it's much more in your face. And so I think now more than ever, the conversation has turned to, okay, well, what can we do to help create more resiliency in our body? And, there's so many things. I think people are just saying, oh, well, we'll have to wait until there's some medication or a vaccine. And I think that conversation is important to have, but it's also important to recognize that your own body has a pharmacopoeia inside of it that is unparalleled on this planet. And there's so many things that we can do, whether it's good sleep or, adequate water or exercise or diet or supplementation or acupuncture, chiropractic. All of these things are going to increase our body's ability to fight off illness and it boosts the immune system. I mean, acupuncture and chiropractic are well documented for increasing the body's parasympathetic nervous system response. So there's, yeah, sympathetic and parasympathetic. And so sympathetic is what a lot of people are in, where they're stressed out and it's that fight or flight nervous system. And that inhibits or completely shuts off immune pathways. Whereas parasympathetic, which is that rest and digest, it's where you're healing, that's going to facilitate or turn on immune pathways. And acupuncture increases parasympathetic nervous system activation, as does getting your spine adjusted in chiropractic care. And those things are directly related to increased immune function. And so, that's just one little tidbit of all the different resources out there for people. And that's, again, like you said, a vision is being able to be here for our community, to empower them to take control of their own health, and then also putting a mind's eye to what we can do preventatively and proactively as we start to, emerge from this pandemic and start to slowly reopen New Hampshire.
Yeah.
Yeah. So thank you so much for spending the time and energy to have this conversation. I think it's a necessary one, and I'm so excited to be able to start to refer patients with you guys again, and look forward to when you can be open.
Thanks, Michael. Me too. Thank you for doing this.
Yeah, you're very welcome. Have a great rest of your day.